when we look at the brain, sometimes it's just finding the right combination of supplements, medications for neurotransmitters to help. That's one group. Two, if you've had trauma, the supplements, medications may help some, but usually you've got to do other more rehabilitative treatments to the brain, like hyperbaric oxygen therapy would be one. There's post-electronic magnetic field therapy or something called photobiomodulation you can do. And then there's this whole new group where people coming in and they're depressed, they're anxious, they can't focus. Then they got numbness, they got tingling, they got stomach problems, they've got headaches, they're overweight, they got insulin resistance or diabetes, and they've been on X number of antidepressants or anti-anxiety agents. And we look at their surface of the brain, and there's patterns we see associated with inflammation. And those groups, there's several kind of different avenues right now that are used to address the inflammation.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who is out there helping us humans to explore, expand, and explode.
Hey, welcome to The Exploding Human. My name is Bob Nickman. My guest today is Dr. Jay Faber, and we are going to be talking about issues with the brain, from traumatic brain injury to inflammation and other issues, and how he treats patients at the Amen clinics. But first, I'd like to invite you to visit my website, theexplodinghuman.com. Over there, you can listen to episodes, read synopses, see photos of my guests, and there's a little bio on myself. You can also listen to the show on YouTube. That is The Exploding Human with Bob Nickman. As I said, my guest today is Jay Faber, MD. He has been in the field of psychiatry and forensic psychiatry for over 30 years. He's on the staff at the Amen clinics, which does a variety of treatments and modalities to help people with brain issues, from traumatic brain injury to brain fog, confusion, Alzheimer's. There's a whole variety of treatments that we're going to be talking about, and how he got into nutrition and the body-mind connection when dealing with the brain. There are many biological factors which affect people's moods and behaviors that aren't psychiatric issues necessarily. This is a fascinating talk. Jay really opened my eyes to some of the work that is going on there. And then we segued into talking about how humans can help other humans and providing inspiration and hope to people. It was a really nice talk. He's a wonderful man. I really enjoyed talking to him. So here he is. This is Dr. Jay Faber. Jay, thanks so much for your time. I really appreciate it. I've been wanting to talk to you for some time, so it's really an exciting thing. And we're going to be talking about your work with brain scans and nutrition for the brain. And I wanted to start with something that has always intrigued me. And I heard Dr. Now I'm going to say it wrong again. Amen?
Amen. Perfect.
Okay, Dr. Amen, who's and you work for the Amen Clinic. I saw a podcast with him and Dr. Mark Hyman,
Yes.
and it was a great podcast. He's Hyman is I guess a functional medicine MD. Dr. Amen said something that really intrigued me. He doesn't like to use the word or the term, I believe, mental illness necessarily. He likes to look at it as brain health, which I thought was great, because that sort of takes stigma out of the whole idea, and it looks at the brain as an organ in the body, or as a system that can be. And he said something that shocked me, that 80%, I think that was the number that he used, of issues with the brain can be dealt with on a biological level and mitigate these problems that come across as mental health issues?
It sounds close to 80%. I'd have to look at his work. I would say biologically, I think there's a much, much larger percentage of things we are now doing, and also I think things that are coming that is exciting. But the brain, like your stomach or your heart, though, it's an organ. And in that organ, there can be areas that are working great and other areas that aren't working great. And if we can figure out ways to address those areas that aren't working so great, it really makes and it makes a big difference. Because of that, terminology is starting to change as well. So things like major depression, bipolar disorder, generalized anxiety disorder, we don't get rid of those, but we also start throwing in words like amygdala, hippocampus, temporal lobes, anterior cingulate cortex, the subgenual anterior cingulate cortex versus these are all big fancy words, the dorsal anterior cingulate cortex to your thalamus. And it's going to grow because as we're able to look at the brain, and this to me is really exciting, in a much more in-depth level on how it's functioning, we're learning more and expanding our ability to help people.
It's amazing. I've talked to a naturopath about brain health recently, and I was asking him what are some of the things people can do to help with focus, memory, brain fog. All these kinds of things can really be mitigated by diet and supplements, and certainly meditation and exercise.
Yeah.
That has, yeah. And I'm sure that's part of what you're doing. I did watch a video probably about 8 months ago, and it was a guy that had come in. I think he was I think he was a boxer, and you did a brain scan of this guy. That was really fascinating to me because he seemed to be doing pretty well when this thing was shot. The video was shot, and he had been having some major issues. I mean, obviously, if you're going to get into a boxing ring, you're going to get whacked, and you're going to have physical traumatic brain injury, I would imagine.
Well, yeah. I mean, we used to go back, to like say the late 60s, early 70s. I mean, I've probably seen like 100 like pro football athletes, and it'd be like, some teams they'd have 3 a days, not 2 a days. Like, I played high school football. You had 2 days. That was like, they had 3 days, and it's constant hitting. And we used to think, well, you get hit. What do? Just get the smelling salts, take a sniff, get your rear end back out there in the field, and quit crying. And there's problems then, but as you get older, they worsen because our brain starts to lose neurons, and these poor players and boxers can have memory problems, focus problems, mood-related problems. We used to say, it's CTE. It's like some kind of a mysterious, like viral illness where if you get hit a bunch of times, your brain just progressively worsens. And what it turns out most likely is now going on is where you've been hit, you've lost neurons. And so as we all get older, we just generally lose neurons. So those areas that are already vulnerable, there's problems. That's sort of the bad news. The good news is we're starting to figure out a lot of things we can do, from supplements to like that boxer hyperbaric oxygen therapy can be done. If you've got pituitary gland issues, we can check for that and get your hormone levels better. So there's a lot more now, and I think there's a lot more coming, to be quite honest with you.
I'm excited about that because I think that's sort of the way we don't know a lot about the ocean and outer space. That's what the brain, the inner space part of our bodies, we have a lot of mechanical sort of knowledge of the different organs, but the brain seems to be the most amazing frontier. And now we can look at it with scans. And somebody told me once, when my dad got older, he started having seizures, and they told him that it was possibly he had a brain injury when he was younger, something, concussion or whatever, and that it manifested later in life as seizures. Did that sound like something?
Well, I mean, yes, there's two sort of theories. One is if there's an area of injury, there may be neurons, those are the cells of the brain. If they start malfunctioning and they misfire, that misfiring can lead to a cavalcade of other neurons misfiring. And with that, it can go from, like, say, your sensory cortex to your motor. Then all of a sudden, if your motor cortex takes off, your whole body starts shaking. The other is the psychogenic seizures, which we're learning a lot more about. We used to think psychogenic seizures, some people, they've had trauma, emotional trauma, abuse, or other things, and their EEGs, which would show those abnormal neurons firing, we're not seeing it. Oh, so it's a psychogenic seizure. But now we're learning that it may be regions of the brain, networks of the brain, where some areas might be more active than other areas, and there's a mismatch. And because there's a mismatch, that mismatch can lead to a seizure. So the neurons are working fine, but because some areas are working harder than others, we got to take those networks and kind of calm them down. So that's a whole nother topic that we're learning more about. And when you tell somebody they have a psychogenic seizure, I mean, it's like you go see a psychiatrist. It has a stigma to it.
It's so fascinating. When I was reading an article recently about some brain mapping, and they were doing in some animal which had a much simpler brain, but the with the use of computers and all the data gathering, how far they've come just with that, and that eventually we're going to be able to map the brain and come up with even more solutions. But when they say brain mapping, what exactly does that mean? Does that mean like DNA? What is that? Is it?
No, that's a good question. That brain mapping, it depends kind of which field you're talking with. Probably the biggest would be QEEGs. So an EEG, what is that? You put a big cap on your head and you measure the electrical activity. And we used to see these waves that would do all these crazy things. Now we can take all these waves that do crazy things with technology and computers. We can start to figure out how strong the voltage is for different frequencies. And then those are mapped to different regions of the brain. So that's one concept. The other place we hear brain mapping is with something called EMDR, which is a little bit more complex, and I'm attuned to it. I'm not as adept as some others of the brain, but we're learning through trauma, certain areas of the brain may be triggered, and through this therapy, you can kind of learn which areas and spot them and help stop some of the intense memories that some people get with traumas.
Yeah, it's amazing how some of these modalities can actually change psychological, or I guess that's the word, outcomes.
Yeah.
By reprogramming the brain. You reprogram that. Yeah. What we think is there's connections between the front part of our temporal lobes called the amygdala and the back posterior part called the hippocampus, our memory. And we think what's going on is we're changing the circuits of the brain between those two areas. So I think there's, again, and I'm using different words. I really think psychiatry, the terminologies are going to be drastically changed and educated at all levels, from medical school to residency, in the next decade. There's a lot of new stuff coming out. And it means we have to, me, who's been in practice 30 years, find structured instruments to stay ahead of it, which is actually kind of fun. Well, I think it's amazing. I mean, I have a daughter who's in first year medical school, and some of what they're learning is fairly antiquated. Not antiquated, but it's the formal kind of thing that the AMA has put in place to teach in medical schools, and it's very like regimented in a certain way, and there's not a complete holistic approach, but it's starting. I'm starting to hear more of it.
When I went, this is just my experience, and for all the other doctors, they probably have their own experiences. But you go to college 4 years, go to medical school 4 years, then you do a residency. I did 4 years of adult, 2 years of child, and then a year of forensic psychiatry at USC during the Simpson trial, which is a whole nother story in and of itself. And we'll leave that to another time.
Yeah,
I know way too much.
Oh, okay.
Yeah, way too much.
I think I'd like to have a private conversation on that one.
I got so many stories. But anyhow, my point is, you do all that education, you get out in the real world. It's like, hey, I know everything I need to know. I'm set for the next 35, 40 years of practice.
Yeah.
Well, if you go by Harvard Business School, which says, hey, and I learned this about 15 years of my practice, and it was rather humbling. If you don't keep up within 5 years, you're behind the 8 ball. And that was humbling. And it's like, I need to get on sort of a more accelerated course, not for me partially, but more to help people.
Right. And
that's why we went into medicine. I mean,
yeah,
you know,
right.
what a new
Supposedly,
concept. What a new concept, you know?
Yeah. I mean, you know, you just don't want to be a shill for big pharma. You don't want to do
that. Well, you know, pharma's got their pluses and they've got their minuses. And I would say this is just sort of my feeling is when it changed. I mean, we used to have, you know, drug companies take us to Puerto Rico, you know, take us golfing. I go, this is great. I'm having a great time, you know, and they had some science courses. It was good. And when they took it all away, I mean, I wasn't pleased, but, you know, about 2 months later said, you know what? I go, this was the right thing to do. We want to, I don't need anything. It's like, you've got to look at things unbiased as best as possible. And when people do that, you're going to get biased. It's inevitable. And that goes beyond medicine, by the way, too. But I thought it was a good move. And the pharmacy companies, like all of us, we've got opportunities for improvement, but it's changed a lot.
I'm happy to hear that. I knew a young woman who was a salesman for them, and she was basically said we're sort of glorified strippers. We come in dressed hot and we, you know, bat our eyes at the doctors and they buy stuff. And that was really how she was kind of trained in the sales end of it. And she got out of it, of course, but it was kind of eye-opening when she told me about this. This was about 20 years ago.
Yeah. But, and it creates, I mean, if someone's like really interesting and they're attractive, is that going to influence you? You're at least going to listen more to the person.
Yeah.
So yeah, it does.
I want to talk about the type of patients that come into the clinic, what you can learn from the brain scans. And I'm sure do you always do a brain scan when somebody comes in? Because to me, that's such a fascinating thing to be able to look at that. You know, I've had other types of scans, body scans for, fat ratios and all that kind of stuff.
Yeah.
I think that stuff is so interesting. I would love to know what's going on in there.
Yeah. Well, we do, for those who are listening that don't know, we do something called SPECT scans, SPECT. It's a big word. I won't say all the letters mean, but it's a scan that looks at blood flow to the brain. MRIs look at structure. You get a good idea what the picture is, but we don't really know how the brain's working. When we look at where the brain's getting too much or too little blood flow, we get a much better idea on how well it's functioning. So we do these SPECT scans that tell us where the brain's working well, where it's working not so well, and where it's working too hard. And from that, we can then target, focus treatment to those areas. We never use a scan to diagnose. You don't say, oh, this is blah, blah, blah. Mm-hmm. But guess what? Neurosurgeons who use MRIs and fMRIs don't diagnose. They use that for vehicles to target where they're going to do their treatments. And that's sort of what we do from that. At the clinics, Dr. Amen, he's been on top of this since about 1989, 30 some years, 200,000 scans. There's a lot of data, of which most of it's stored, and he's now able to use for research. So that's sort of the side thing. But I'm trying to say it's getting to be fairly credible. And I'm using probably mild words with that. So people are kind of like, oh, neuroimaging, blah, blah, blah. It's not. In fact, interestingly, this is as an aside, 2016, the Journal of Radiology put out an article called Psychoradiology. First time I've ever heard that word. I found this out last week. Oxford, that was 5 or 6 years ago. Last week, I was on Oxford Press, England, Oxford, kind of a reputable group. They now have a quarterly journal called Psychoradiology. So this neuroimaging stuff's hitting. So that's what we do. I'd say 80 to 90% of people get scans when they come in. those that don't, it's not the like anything, reality is it does cost something. Or some people, because of radiation, they don't want to get that, they don't get it. So the people that come in are usually people who've they've been to umpteen doctors and they're just not getting better. And so it's like, where do we go? And it's like, and by the way, that's scary and it's suffering. It's like you see all these doctors not getting better. It goes beyond just being depressed or anxious. You feel hopeless. So that's predominantly the people we see. And so when we look at the brain, sometimes it's just finding the right combination of supplements, medications for neurotransmitters to help. That's one group. Two, if you've had trauma, the supplements, medications may help some, but usually you've got to do other more rehabilitative treatments to the brain, like hyperbaric oxygen therapy would be one. There's post-electronic magnetic field therapy or something called photobiomodulation you can do. And then there's this whole new group where people coming in and they're depressed, they're anxious, they can't focus. Then they got numbness, they got tingling, they got stomach problems, they've got headaches, they're overweight, they got insulin resistance or diabetes. And they've been on X number of antidepressants or anti-anxiety agents. And we look at their surface of the brain and there's patterns we see associated with inflammation. And those groups, there's several kind of different avenues right now that are used to address the inflammation. I'd say this is just me personally, and there's different people. I went back and did a 3-year fellowship at George Washington University in integrative medicine on this whole topic, which is like, it was 3 years of like some of the hardest work while I'm seeing patients during the day, but it's worth it. And for those doctors who are listening out there, if you have an interest, I would look at the George Washington University program with Dr. Andrew Heyman. It'll revolutionize, and I'm not trying to be dramatic, but it's very true, the way you look at how you treat some of these inflammatory conditions, amongst other things. So I'd say that's probably 45-50% of my practice right now is that group.
Okay, that's really interesting to hear. I just interviewed a guy, I guess you would call him an integrative medicine doctor, who went to conventional medical school. And he said, the question I ask myself when I see a patient is, well, I can sort of figure out what they have, but I always ask myself, what else could it be? Is there something I'm not seeing? Yeah. And I thought that was a really, really smart way to look at anything, really. Any problem you're trying to solve. Maybe it's not the thing I think it is, or maybe it's the thing I think it is, but something in addition to that, which is really, you're constantly testing yourself and trying to, it's problem solving, which when you solve it, that's one of the most joyous things you can do. And that's in any field. I just think that it's problem solving that way and coming up with a solution to help somebody is just an amazing thing. Can you tell me about the oxygen hyperbaric
oxygen therapy?
Hyperbaric, yeah. What is that? How does that work?
So hyperbaric oxygen therapy is a therapy where you sit in either like a big, what we call hard chamber tank. It's basically a aluminum or steel shaped container where you go and sit down, or a soft chamber, which is like a plastic tube, almost looks like a balloon. You can lay in, you can bring your computers, your books, you unzip it, you jump in, lay down, zip it up, and then you increase the oxygen concentration and atmospheric pressure, more the atmospheric pressure to like 30 to maybe sometimes 100%, but usually 30 to 70% above the atmospheric pressure. It pushes oxygen across your blood-brain barrier. And what it does is it starts to rehabilitate those areas of the brain that have been injured. Typically, you need to do at least 40 sessions, and they last about 55 minutes each. But for those with TBI, it's incredible. In fact, if you wanted, I could show you a before and after picture of somebody. I don't know if we could do that on the show or share screen.
Well, I'd love to see it. if you can want to put it, I mostly just use the audio.
Oh, you can. I can show you if let's see. I got to have you give me screen privilege. Okay, so here is a brain. This is when I was back in Atlanta. This guy did something called play NFL football.
Oh,
for 8 to 9 years.
Ouch.
And so he was 5'9", hit literally like a beast. And this is the results. These scans should be smooth. This is looking at your brain from the top down, bottom up.
So there's a lot of
bumps, right?
Bumps and dark lines and
yeah. So this should all be smooth. And I won't go into what areas mean what.
Yeah.
We did hyperbaric oxygen. We did 40 sessions. And he said, hey, in a month, can I get another scan? I said, yeah, let's do another scan. So we did. And here's what his brain looked like 30 days after his 40th session.
Wow.
Yeah. Now here, he was drinking like a fish, couldn't get out of bed. Last time I saw him, he was selling pharmaceutical goods, working 10 to 12-hour days. I haven't seen him for 6 years because I moved.
Wow. Especially that upper left one was so that one picture that was like deep, dark crevices all around there, and then and then it's just you can barely see the crevices in the after. Wow. People
here, these are temporal lobes. They should be like fluffy cotton balls. We get bumpy like this. People get really anxious, but they get really angry, irritable. They can get paranoid. So the NFL players have a 50% higher domestic violence rate. And you wonder why? It's like, is it a mental health issue or is it a brain issue?
Yeah. Well, in this case, it would be, I mean, just looking at these photos, you can see that there's a huge difference.
Yeah.
So that's that to me, the big takeaway with all this is brain health versus, a mental health disorder, which I don't even know what those are sometimes, because most things are caused by something. I don't think people are necessarily born with a lot of some of these things that we're talking about. Trauma in particular is something that, if we're not talking about physical injury, but we're talking about traumatic events causing physical changes in the body. That was fascinating. When I interviewed our mutual friend Jamie Mustard and Dr. Eugene Lipov, that's what I was blown away by. I had no idea that there was that connection, that there was a visibly physical thing going on in the body based on a traumatic event.
Yeah, I mean, and we've done so Dr. Lipov's work. We've done some, and not enough. I think these are more case reports, so that the validity goes down. You really want like a lot of people who've had it and not to compare. But the people that have done the spinal ganglion blockade in their neck, they get a shot in their neck, and we've looked at scans afterwards, and their frontal lobes and temporal lobes, and a lot of them are starting to look much better.
It almost seemed like it couldn't be true, but it is.
If you talk, like some of those people I've talked to, like these are war vets, the angry rages. And I had a couple of the wives come in and they're in tears saying, I can't believe this is my husband. He's finally back again.
Yeah.
It's like, what do you say? It's like, it's something's going on.
Well, the interesting thing that Dr. Lipov also said, he does not like to call it PTSD. He likes to call it PTSI, post-traumatic stress injury, rather than a disorder, which he feels is stigmatizing. And there he goes, you can see the injury, so let's call it what it is.
Yes,
it's an actual injury, which I did a documentary a number of years ago. I didn't do it. I mean, I was involved in it. I wasn't the director or anything, but with veterans trying to do comedy for healing. It was called Comedy Warriors, and every one of these men and women had PTSI. Every one of them, whether it was from actual getting a limb blown off, or helicopter things, or just because you're firing cortisol all day long when you're in the military. So you're high stress, your body is traumatized, every one of them. And it's amazing to me how I guess the military is starting to find out about this work. I'm hearing more about that in some of my podcasts. So I'm happy.
Yeah.
I'm happy to hear that. You probably get a lot of military people coming in.
Get a lot of military people. I guess 5% are military people, and most of them have trauma, witness trauma, and they've got anger problems and temporal lobe issues.
What would you say is one of the most remarkable cases that you've seen, dramatic cases, let's say?
There's two like that stick out now, but there's a bunch. When I was back in Atlanta, we had one 30-something come in with his parents, and he'd been using drugs and selling drugs on the street. Didn't even want to come in, so his level of motivation is like low. And I go, well, let's see how this goes. And
yeah,
we always talk first before we show the scans, and he's like, it's kind of just blowing us off, which we see a lot. Then he sees his scans, and it's like the eyes turn, the light bulb started going. I go, oh my God, it's like I can finally see what drugs do to your brain, because you can't see the brain. So, I gave him a plan. He came back like a month later. So how you doing? He says, I'm doing good. I haven't used since then. You haven't used what? Drugs? I go, you gotta be kidding me. I go, yeah. He says, I've lost like 15 pounds. And I go, really? And so we started talking about it. I says, well, what's kind of motivated you? And he says, well, it's the whole thing with numbers and weights. I want to get down to a healthy weight and be healthy. So it's like, okay, it's not even the brain, it's the weight. So we just played off that, came back 2 months later. He was still sober, not using. And he was starting to take training classes, gym classes. Came back 3 months, said I'm doing training classes and wanted to become a certified trainer. Came back next month, was taking classes to be a certified trainer. Month 6, comes back, still sober. All right. And he's got a certified training. Now he tells me he wants to join the Navy SEALs. Now you put that one, someone living on the goddamn streets, selling drugs, to 6 months later wanting to become a Navy SEALs after being, this is like insanity. How long does it take? If you break your femur, how long does it take to fix? It takes 6 months. Does it take the brain that long if you do the things we say?
What else was he doing? Was he taking supplements?
He was taking our supplements.
Mm-hmm.
He was working with a mindfulness-based therapist that they teach you how to calm yourself naturally.
Oh, okay.
And he was doing his exercising and just structuring his day. It's like, scheduling. It's like when you get done with school, whenever that is, it's amazing how structure can suddenly go out the door. But for him, I just said morning, afternoon, evening. Make sure there's one activity that's a wellness-focused activity that lasts about an hour.
And the thing that made him want this was seeing the photographs, the scans.
The scans started the whole process. And then he started getting to the gym. He says, oh my gosh, I can be sober and I can lose weight. It's like measuring if people can, just in general, if you measure something, it's getting better, people get more motivated. I mean, this is just me. I got a foundation I run, and I see a lot of, inner city youth being 18 to about 30 years old who, they want to sing, dance, whatever. But in terms of having the internal qualities of leadership, they've never been trained. And so that's where we kind of come in as well. And so if we had systems, I'm working on something else I can't even go into right now, where we can go in the inner city and start to educate, and I think just as important, inspire people to see what could be, create hope and optimism with that's based on reality. It's not just some pie in the sky. That's based on hard work, resilience, determination. It'd be huge. You've hit huge.
You have hit on something that I think is the core of how to change a lot of problems that come out of that particular demographic. But in a lot of the idea, how the government programs have the war on crime, the war on drugs. How about the war on hopelessness? That's really that's really the thing that that has to change. And then the other stuff falls into place. You don't need to be going after people who are committing crimes if they're not committing crimes because they have hope and they have a life that's actually working. Now, is it lofty? Maybe a little bit, but is it possible? I think it is, and you're doing that work. So congratulations on that. I love this. We
had, like, when COVID hit. All right, I'll tell you a story, and I'll try to keep my emotions in. But I live like kind of close to UCLA, Beverly Hills, Santa Monica. All of a sudden, all the tents started coming up.
Yeah,
like
that's where I am. So I know that's where I am. Yeah.
So close to Beverly Hills, and it's like a Saturday. So I'm going, wow, I've never seen those out here before. The next day, the tents were then they had all this junk, and I said, oh Lord. I said, something's going to happen. And I went home and it kind of bugged me. It just bothered me. It's like, man, I go, we got to help these people. Plus I need to understand. So I went, it was like Mother's Day. Someone got some, I don't say this loudly because I don't do this often, but I got some donuts for them. I'd give them a healthy snack, but I thought that would connect better with them. So I went down there. There's like probably 10 tents. And I'm like, oh, this will be interesting. And I'm scared half to death. I mean, someone could pull out a gun and shoot me, And I said, hey, I go, hi, my name's Jay. I was like doing the golly gee shucks. I'm from Midwest initially. And I said, you know who owns this tent? And this lady comes out, African-American lady, and says, it's my tent. I go, hi, my name's Jay. It's a happy Mother's Day. I said, listen, I just want to bring out some donuts. And I brought down some plastic bags, just in case, you want to pick up things. I thought you might want them. And then after I said that, it's like I just got every other word's like the F word. You mother effing, you effing this. My effing boyfriend left this morning and took all my effing stuff. He took all my effing money. And you expect me to do effing this? And I just sat there and I listened. I go, I don't know what I'm going to do. I mean, this is like totally in the moment. And so she stopped screaming at me for a second. I get my wallet out. I pull out $2 $20 bills. And I give those. I said, here, you can have these. And you know what she says to me? Here come the tears. I mean, she was like, it's like hard. It's like, wow, this is intense. She's like, she needed the money. And I knew she needed. And so she took the money. And then I listened to her language, right? Now it's me time to go into her world, not my golly geez, professional talk. And I said, listen, I'm going to tell you something right now. I said, that is your mother effing $2 $20 bills. You hide that MF and money wherever you need to, but that MF and boyfriend, if he shows up, you don't have S. This is your Mother's Day. And I said, listen, I'll check by in a couple hours, see if you guys are okay, but have a good day. So I left. I didn't go back in, but I went back like 3 hours later. And guess what? All the garbage picked up, all the garbage in the plastic bags. All they need is somebody to care. That's it.
Yeah.
That's it. She probably learned something about me. I learned a whole lot. Wasn't like going to the university.
The idea that when somebody is angry, what does that mean? It means they're in pain.
Yeah.
It's pain turned outward. Depression, pain turned inward. So if you see somebody who's depressed or angry or flipping from one to the other, not really rapidly or anything, but that means there's some kind of a pain under it that has to be looked at in a way that's, the way you did it, which is connecting.
Yeah. See, it's, if you want to use the psychiatric jargon, we never do this in practice, but I was empathically attuned with where she's at.
Yeah. Empathically in tuned. Yeah, sure.
That's it.
Attuned. Yeah.
And who can't do that? Anyone can do that. But it takes some guts. It takes some chutzpah, and it takes leaning on some other values than I think some of the ones I see. And I'm not talking about morals. I'm talking about, bravery, courage, passion determination,
Yeah.
whatever ones you got. It's like you want to bring them to the table and make this place a better world, a better place.
Yeah, well, I applaud your effort on that. It's it's an unfortunate way that the country has gone with all that stuff. I do a little work with on Sundays at they called the Access Center in Santa Monica, which is I make sandwiches. That's all I do.
Yep.
But I talk to some people out on the that are out on the street waiting to get showers, and
yep.
I think there's a real appreciation for just acknowledging their humanity. Some of these people are it's just some bad hops of the ball. Some of them are addicts. Some of them have mental health issues. Some of it's just things happen to people, and you don't know why. Some people are not able to get out of that. Some aren't, but that place offers a lot of non-judgmental help to a lot of people. I mean, you can go there and get a shower and put your stuff in a locker, talk to somebody, medical care, just all kinds of stuff. So if it really is a place that offers hope to people. Now, I don't know what the percentage of success is with people, getting housed and all that stuff, and they help people find housing also. So, it's a start, it's a dent in the problem. So,
well, I admire your willingness and sincere, genuine sacrifice to go out there, connect with them, and I would be willing to bet you learned quite a bit.
Well, yeah. I mean, I try to connect with people on that level that you connected with that woman, which is, heart to heart, if that's possible. But, just to have a conversation where a person is not being looked at as beneath somebody else, because a lot of times on the street, that's how they're looked at and talked to.
Yep.
And every one of those people was a child running around somewhere having a nice time, probably, and who knows what their upbringing was.
Yep.
So it's a range of people too. It's not necessarily one group. And I found a lot of those folks are pretty generous, even though they don't have a lot. They're very generous with each other, which is kind of surprising.
Yep.
But I guess there's a knowing that's, there's a non-attachment to stuff because they don't have much of it. So when they get it, they're generous with it. Of course, there's the pervasive smell of weed, which, if I was sleeping on a sidewalk, I'd probably be doing that too. So I don't really have an opinion about it other than, okay, if it works, do it,
Well, I mean, if there's not many ways to enjoy yourself, I mean, people are people. It's what happens. I'm not condoning it, but it's like, hey, we got to figure it out. That's a starting point. What else can we do?
Yeah. I don't know what your schedule is to have to get back to work or anything.
Got about a minute, and then
okay. So I don't know why I just picked that up. I thought, Jesus, I don't know why. Maybe some sort of nonverbal communication, Jay.
Yeah.
You're a genius. You're a genius.
Well, it's all about brain health. I mean, even it's like you can talk about the clinic, but it goes way beyond the clinic, right?
Yeah.
Your story is what you just said. That's beyond clinic.
Yeah, absolutely.
It's real. It's raw.
Is there anything that you found, and this might be way out there as a question, looking at the brain, when we talk about spiritual matters, are there areas that, I know they've done studies with meditating, monks and things like that, and seen active parts of the brain. Have you noticed anything like that since we're into this compassion and humanity thing?
Well, there's research out there like the temporal lobes.
Yes.
There's a higher association with spirituality, and that gets how I define it. People who've had right temporal lobe damage, we see oftentimes a higher association with higher levels of spirituality. We don't know why that is. So people who become pastors or become, priests, nuns, whatever. We don't know why that is, but
I love hearing this stuff. Let's just plug your book, because I know you just came out with a book called Escape, and the mission of that book is to help people stay out of the legal system. And maybe these reasons are what we've just been talking about. So, tell us about the book and your website, and then I'll let you go. And thank you for your lunch hour that you just gave me.
You're welcome. So the book's called Escape. It's actually been out now for about probably 8 years.
That long? I just saw it on your website. It says new. I thought it said new book. Okay.
I got
it's been out 8 years. Okay.
It's been a while, but it's called Escape, Rehab Your Brain to Stay Out of the Legal System Forever. And so the book is primarily for those who are in prison or involved legally. And it goes through 5 concepts on if you do these 5 things, you'll stay out, and in it has stories from Michael Jackson to Elon Musk to Avicii, who's a well-known EDM musician. So we try to make it kind of contemporary and applicable. The book can be downloaded from my website, www.drjfaber.com, for free. I wrote this book for free because the people who need it the most can't afford it. If you want to get it at Amazon.com, you can do that for, I think it's $6.95. But it's there. And the next book I'm writing right now probably won't be for free. So, but the first one I wanted to get back. So it's out there for the people who need it. I think don't have the cash to pay for it.
Thank you so much for talking to me. And I know this was your lunch hour and you squeezed me in, and I really appreciate your time, and go help some more people today.
Thanks, Bob. You're a great interview. I really enjoyed spending time with you.
Thank you. Same here. Have a wonderful day.
Okay. Bye-bye.
Much appreciation for you folks listening in to The Exploding Human. Check out the website, theexplodinghuman.com, the YouTube channel, The Exploding Human with Bob Nickman. Once again, thanks to Jay Faber for giving up his lunch hour to talk to me and to get some information out there about the brain and how we can treat some of these things that are going on with people. Have a fantastic day. Thanks so much.